Hello. Hi, how are you? How are you doing today? My name is Temitope Shimbanjo. You can call me Temi. I am a student nurse from Mountain View College, Dallas, Texas. May I know whom I'm speaking with? Penny Jones. Can you please verify your date of birth? 0305 1975. Thank you, Miss Penny. Um, I'm going to adjust your bed to workable size for you and I, and I'm going to provide privacy. Miss Jones, I'm here to take your vital signs and perform physical assessment. But before I can touch you, before I can do anything, allow me to perform. And the gym. I get my sanitizer. I rub it over. And please, let me put on my gloves. Miss Jones, in taking your vital signs and head to toe physical assessment, I'm going to be asking you some questions. Please, I want you to respond to me accordingly. And to let you know, I'm going to be touching some part of your body, but I will let you know each time I'm going to touch any part of your body. Would that be okay by you? Thank you. Miss Jones, to start with, I'm going to take your temperature. While I get up my thermometer, can you please open your mouth and lift up your tongue? Can you hold it for some moment? Okay, your temperature reached 98.7, which is good. Then I'll be taking your radio pulse. Can I have your hand move to your upper abdomen? Right here. Thank you for your radio pulse. I counted 35 in 30 seconds, multiply by 2, which is 70, which looks pretty good. Thank you. And for your respiration, I'm going to be counting your heart rate for 30 seconds. The heartbeat, I counted 9, multiply by 2, which is 18. So your respiration, your radial pulse, and your temperature looks pretty good. So, Miss Jones, the next thing is for me to do your blood pressure. I'm going to be taking your blood pressure. So, I'm going to be determining the cough, since I'm going to be using a very small cuff here, and I will remove this cloth to avoid constrictions. So with this, so I'm going to be pumping, and I will inflate at 30 mm above your cytotoxic pressure. I'm going to have my stethoscope to listen to sound. Okay. And I will release the gauge at 2 mm per second. I will slowly release it. I heard the first sound. And the second sound is heard. Miss Jones, do you even remember your normal blood pressure? 120/80. Oh, that's great. The one we have today looks very close. That today is 118/82. That's very great. That's nice. It's closer. So I'm going to be asking you a couple of questions. Miss Jones, do you have any pain on any part of your body? By rating from 0 to 10, bearable 0, 1, 2, 3, unbearable 7, 8, 9, 10. No pain, are you sure? At the back, your legs, your arms, lower abdomen, no pain, chest. Okay, since you said there is no pain, I will have advocate my provider to prescribe medication for you. But since you said you don't have any pain, I think we can continue. Then, I'm going to be having to do your pulse oximeter. So my pulse, can I have your fingers? Okay. All right. Your pulse oximeter. Oh, your pulse is 70. Whoa, very good. And your oxygen level is 94, which is so good. If you compare your pulse oximeter with your radio pulse, they are same. They are very, very close. They are same. They're both same. So it looks very, very good and normal. So you're very okay. So I'll be going to your assessment. But before that, I will document all your vital signs based on your database line, on your baseline data. If there is any variation, I'm going to make a report. So I'll be going to your assessment. Ms. Jones, before I go into that, I'm going to ask you some questions again. Ms. Jones, how are you feeling today? You know where you are? What brought you in here? I'm checking for her mood. I'm trying to see if she knows what she is doing. Do you know today's date? That's very good. That's very good. So, Ms. Jones, do you have any allergy? No allergy? Oh, that's perfect. So I have to move around the bed to see if there's any turbulence, maybe there's any high fields that need to be corrected, any control, nothing. Okay. So I'm trying to provide safety. Are you comfortable again? Let me ask. Okay, good. So we are going to continue with the assessment. I'm going to start from your head. I will first do your hair, your skin, and your fingernails. Looking at your hair, I'm going to be looking for the distribution of the hair. I'll be looking for infestation. I'll be looking for presence of body hair, and I will see if the I will look for the texture. Looking at your hair, yeah, your hair is evenly distributed. There is no infestations. There is presence of body hair. You're not losing any hair. The texture is smooth. In looking for infestation, if the patient has lice, I'm not going to tell her because you're not supposed to tell our patient that one. So I'm going to be going to your skin. In assessing your skin, I'll be testing for the color, the temperature, edema. I'll be testing for the texture, the moisture. I'll be looking for scars. I'll be looking for piercing. I'll be looking for edema, like I said. I'll be looking for mobility. I'll be looking for trigger, which is elasticity. Then I'll be checking for the pressure braiding scale risk. So for your skin texture is smooth. There is no piercing. There is no scars. There is no body hurt. There is no edema, no swell anywhere. The skin is smooth. The color goes with your ethical background. The temperature is okay, so your skin looks very good. For the pressure, let me see if there's anything at the back. Oh, there's nothing at the back. Okay, there's no pressure also detected on your skin. So I'm going to be testing for your fingernails. I'll be testing for curvature. I'll be testing if she has any converse on the bottom of her nails, and I'll be testing for the brush capillary refill. So for the you have a good curvature. There is no converse on nails. Then I will pinch for 3 seconds to see. Okay, there is capillary refill after pinching for 3 seconds. So Miss Jones, all this looks very, very good. So I'm going to be moving further to test for your the face, the necks, the ears, the mouth, and the eyes. So looking at your face, I want to see it's symmetrical. This eye and this eye are in the same position. Your eyes are in the same position. They are symmetrical. Okay, everything looks good. They are balanced. Oh, good. So I'm going to be testing for your eye. I'm going to be testing your eye. First thing I want you to do, can you please perform cranial nerves? Can you puff your cheek? Shine your teeth. Smile. Good. This means you're responding normal. That's very good. So I'm going to be testing your eye. For your eye, I'm going to be testing for the pupillary size. For accommodation, I'll be testing for Perla. I'll be testing if she responds to the light reflex, and I'll be using my pen light. So I'm going to put on my pen light. I'll shine it to the eye. Oh wow, the pupil is not small. Even looking at this one, it's okay. The pupils appear to turn small on the same, and they are at the same place at the same time, the same size. So when I put the light, so it shows she's responding to light reflex and testing for the pupillary size. They look very good. So I'm going to be testing for accommodation. Can you please look straight into the my direction of my hand on this side, up. Okay, good. It shows she's accommodating. So I'm going to be doing the next thing, checking her hair. I'm going to be testing for cerumen or discharge. Looking at your hair, there is no cerumen detected. There is no discharge. Okay, your hair looks very good. There is no cerumen. There is no discharge in the hair. There is no lesion. So have you been using any hearing aids? Okay, no, that's fine. That looks good. So I'm going to be testing your nose. I'm going to see maybe there is any discharge in your nose. Maybe there is any excess skin blocking, obstructing breathing. So I'm going to cover your nose here. Can you breathe in, breathe out with the other side? And this one, breathe in, breathe out. Okay, there's nothing obstructing breathing. That looks good. So I'm going to be going to her mouth. Can you please open your mouth for me? I will put in my pen light again. There is no halitosis, no redness, no sore. The gum looks good. The teeth looks good. Everything looks very, very good. The teeth are aligned. Everything looks good. So there is nothing detected that is bad about facial look. So I'm going to be going straight to assess. I'm going to be going straight to assess our lungs, our thorax, and our chest. But before I do that, let me quickly percuse her face to see if she's having any pain. Lightly, gently. Any pain here? Here? No pain? Good. So I'm going to be assessing your neck, your thorax, and your chest. So in doing this, first thing I'll do is I'm going to have you perform range of motion. Can you move your shoulder up, down, lift your hand up above your head, pull it down. Okay, can you move your neck to the right, to the left, up, down? Do you feel any pain in the chest? Do you have any concern? Okay, any stiffness? Okay, and then I'm going to auscultate the chest, both the posterior and anterior of our chest. So in doing that, I'll start from the posterior portion. I'll put my stethoscope right here, 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 here. Okay, there is no wheezing, no abnormal sound heard. So I'll be going to the posterior part. May I have you sit up, Miss Jones? Thank you. Right here. I'm moving in the snake-like direction. Doesn't matter where you start from, but just for me to achieve my goal. Okay. There is no detected. I didn't detect any abnormal sign. So the sound appears very, very good. So with that, I'm going to be moving straight to assessing her heart and heart vessels. I'm going to auscultate the point, the PEMI. I'm going to be locating the apical pulse. So the point of PMI is point of maximal impulse. Also, and I'm going to be looking at where I'm going to be saying maybe it's normal. So I want to ask you, do you have any chest pain? So I'm going to be locating the apical pulse, which is looking here for the apical. Look at the jugular vein. You move down. It's located at the fifth intercostal costal space between the ribs, and we want to look here the X1 and S2, and the location S1 and S2 is okay. Okay, so so I'm going to palpate and auscultate the artery, which is located here. The carotid artery, I'll palpate first. Okay, then I'm going to auscultate the carotid artery. Okay, it sounds good. The pulse is okay and the sound is okay. So I'm going to be palpating the jugular vein. Can you please turn your neck, move your neck to the other side, turn right here. The other jugular vein is at this side. So the jugular vein is okay. So I'm going to be assessing my bilateral radial pulse and assessing bilateral hand grabs. So for the radial pulse, I have to do the two hands at the same time. So I'll have it this way. Taking the pulse. Good. Then for the bilateral hand grabs, can you please hold your hands this way? Okay, good. So with that, I've been able to assess I've been able to assess the strength in her. She was able to hold my hand firmly and I can feel it. So I'm going to be assessing her abdomen. In her assessing her abdomen, I'm going to be doing 4 things. I will assess, that is, I will look around. 2, I will auscultate. I will auscultate the abdomen looking for tympani, and I will percuse, then I will palpate. I'll palpate, then I'll percuse looking for tympani. Sorry, then I will palpate. So looking at her abdomen, there is no contour, there is no scar, no piercing, no body heart, no symmetry, so no surgical incisions on abdomen. So I'm going to be auscultating to listen to the sound for abnormal bowel sound. Okay, the bowel sound, there is presence of bowel sound, there is nothing abnormal. That is very good. So I'm going to percuse for tympani. So I'm going to percuse slightly. Do you have any pain? Any pain? Is any pain there? You feel any pain? Any pain? Right here? Okay. There is no pain. Good. So I'm going to palpate. Do you have any pain here? Please let me know. Right here. How about here? On this side? Here? Here? Okay, there is no pain. Okay, I'm going to ask you a few questions. Do you have appetite? Have you eaten today? Do you feel like nausea, like vomiting? Do you have any pain? Do you notice any pain in your tummy? Nothing? Okay. Have you been to the bathroom today? Have you peed? You have your urine, the normal color? Was it the same that like you used to have? Same, it appears to be the same color like you used to have? Okay, that's fine. So I'm going to be doing a musculoskeletal by going to her feet. I want to ask you, do you have any cramps? Do you have any pain? I'm going to have you move your feet up to the, can you do this for me? Fold it to the knee level, put it back. And this one too, fold it to the knee level, put it down. Okay, good. Do you have any pain? Nothing? I'm going to be testing for edema. There is no edema. There's no Halima. Okay, so I'm going to be performing bilateral pedal pulse. So I'm going to be having my hand on the foot, checking the pulse. Okay, good. So the pulse is very okay. So with this, since I've touched your leg, I assume my hand is dirty. I'm going to be taking off my hand glove. So I'll be performing hand hygiene. So, Miss Jones, I want to talk to you again. Who are you again? Do you feel safe where you live? Your environment? Whom do you live with? Do you have any issue of concern you want to discuss with me? Is there anything you want me to do that I've not met today? Anything of concern you feel I should do I've not done? Okay, I'm going to adjust your bed to a comfortable side and I'm going to give you your bell. Here is your bell by your side. Please feel free to call me. I'll be in the next room. I'll be back in the next 30 minutes to check on you. But if there is anything of concern, please press your bell to call me. I will surely be back and assess you. Then I will document everything I have done. Thank you.